healthcare, there is often too much information and not enough time. Here at the Melanin Initiative, we avoid TMI by breaking things down into language you can understand. We create a safe space for you to ask your questions and share a nursing perspective without taking up too much of your time. Today, we're super excited to talk for the first time on this platform about concierge medicine with our special guest, Dr. Phindile Chowa. She's an emergency physician, author, and owner of EM Care to You. In this episode, we'll learn about her journey to medicine, the services she provides, and about her books that she's published. If you're new here, welcome to the Melanin Initiative. I'm Dr. Kimberly Madison, a doctorally prepared nurse practitioner and one of your co-hosts here at the Melanin Initiative Podcast, along with Geraldine and Alicia, who send their love in their absence. We're a health literacy podcast. When we say health literacy, we're talking about your ability to obtain information, to understand that information, and then to use it to manage your health at home and advocate for others. It's our hope that by watching on YouTube, LinkedIn, and Instagram, or listening on any of your favorite podcast apps, that you'll be empowered to ask questions, educated on how you can navigate the healthcare system, and confident to manage your health and advocate for others. If you haven't already, we want to invite you to subscribe, hit the thumbs up, hit the bell, so that you can be notified when we release new episodes. When you get there, leave a comment or two. It helps the algorithm know that this information is important so that when people like you look for information like this, we'll show up higher in the search results. Remember, everyone, this show is for educational purposes only. The opinions expressed here are opinions alone. They are not a representation of any of our affiliations. If you think you might be experiencing a medical emergency, you should seek medical guidance and medical assistance from your healthcare provider. If you think you might be having a physical emergency, you should call 911. If you or someone you know might be having a mental health emergency, you should call 988, or you can text 741-741. Dr. Chowa, welcome to the Melanin Initiative.
Hi, thank you for having me. Thank you. I'm so excited to be here.
Thank you. We're so excited to bring you onto the platform and share your journey. Like I said, this will be our first time talking about concierge medicine, and I'm a big proponent of it, and I think the more people learn about it, it just gives them options, and I think that's what we all desire for our patients, is that they're informed about their options so that they can pick the one that's best for them and their family.
Absolutely. I agree with that wholeheartedly.
All right, we have a lot to cover, so let's get started by telling everyone where you're from and who you consider family.
Oh man, where I'm from is super complicated because I've lived in so many places in the world. I originally am from a small country in Africa called Eswatini, formerly called the Kingdom of Swaziland. Very tiny place, population of about 1 million people. I was born there to a Swazi mother, so my mom was from there, and then my father is Zambian. And they actually met in the 70s in America and moved back to Africa, where they had 3 of their children. So I lived in Swaziland most of my life until I was 9 years old. Then I moved over to California. From California, lived in Wisconsin, Pittsburgh, Boston, and now I live in Atlanta, Georgia.
That's a journey.
Absolutely.
And can you share a little bit about your journey into medicine?
Yeah, so growing up in Eswatini, for those who don't know, it is a kingdom, very small place. And I was born during the HIV pandemic. And so that's when HIV really was ravishing our communities as a whole. And being born in a country with one of the highest prevalence rates in the world. So I believe maybe about 39% of people. I don't know if those numbers have changed, but for most of my life, Swaziland has had some of the highest prevalence rates. But growing up and living around that time, being a small child, I got to see health, illness, and death at a very young age. My mother was taking care of my grandmother around the age of 7, 8 years old. My grandmother had suffered the complications of a major stroke. She couldn't walk, couldn't feed herself, and was in and out of hospitals. And so my mom would go and spend days on end taking care of my grandmother, and I would go with her. I would go to the hospitals. I would see the illness, the suffering, emaciated individuals. And I remember one time we went to take care of my grandmother, and she was, laying on the floor. We had to feed her. We had to dress her, we had to bathe her. And I looked around in the room where she was, and everybody around in that room looked really emaciated, and nobody was coming in to check on them. There was no nurse, no physician, and she looked like she was dying, and everybody in that room looked like they were dying. And I hated that. Seeing that, I will never forget that image. I felt that these individuals, including my grandmother, were somehow abandoned by a healthcare system, and there were so many iniquities that existed, and I felt that it was unfair. And at a very young age, 7, 8 years old, I made a promise to myself that I would go into medicine and battle the iniquities that exist in the healthcare system. And I've been on that journey in healthcare ever since. I never wavered from that dream of doing medicine.
And what inspired you to go into emergency medicine in particular?
Yeah, so I originally wanted to do women's health. I wanted to help women. I felt that women were the entrance into the community. And I was actually going straight. I had all my letters to do OBGYN, and I did a rotation in a rural area in Pittsburgh in the Mon Valley. And, I was shadowing two male physicians, OBGYNs, and I was doing what they were doing. Going to the surgeries, going to see the patients. They had full schedules. They would go operate, they would go deliver babies, and then they would go give the little they had in their homes. And honestly, the quality of life for me threw me off because I just felt like I'm not sure that I could see myself, bouncing between all these things and then finding myself, not having that time for myself. Obviously, the field has changed and OBGYNs can, make their lives into what they wanted to. But at that point, I was like, I don't know if I could do this. And so I did a mission trip in Zambia, and, we set up clinics in rural areas. And what I noticed is that the family physicians, internal medicine physicians, emergency medicine physicians mostly had a lot of impact in the area. The emergency room physicians have the ability to not only treat chronic conditions, acute conditions, right? So they can stabilize. If somebody had a cut, they would be able to repair that cut. If somebody had a surgical wound, they could stabilize that wound and get them to where they need to go. And it was fascinating. Every day was different. You saw so many people from different walks of life. And I really felt that emergency medicine physicians had real impact and were at the forefront of the healthcare system, frontline line workers, if you would say.
And do you want to shout out any of your schools that you attended?
Absolutely. So I went to the University of Pittsburgh for undergraduate, and University of Pittsburgh for medical school. And then I did my residency at Harvard University at the affiliated Mass General and Brigham hospitals.
Very impressive. When you were talking about Boston, didn't know you were talking about Harvard. That's really nice.
It'll-
I like to have guests talk about that because when students are picking a school,
Mhm.
there's so many options, and sometimes they don't know
Mhm.
anywhere to start. They all look the same to them, aside from
Mhm.
your Harvard and Yales. Those stand out, pretty
Mhm.
significantly. But everything else just kind of sounds the same. And so sometimes when someone they watch tells their story and they relate or they connect with them, they're like, "Well, they went there," and it just gives them a starting point.
Absolutely, absolutely. I loved my training at Harvard. I think I got some of the best training. Um, my colleagues they have so much impact in the world, and that's what attracted me there. They're really leaders in healthcare. They're doing global health work. They're all around the world, and I wanted to be like that. And so I felt that that was where I needed to be, and it was great training.
Well, very impressive. And so, how long were you in emergency medicine before the pandemic that made you kind of pivot?
Yeah, so I did emergency medicine for 6, 7 years. And so when I went into it, I really was, interested in doing global health work. I would take trips to Eswatini. I did a lot of projects back home, and just really working, doing research, teaching here at a teaching hospital in Atlanta, Georgia. And COVID was had some serious impact. I ended up going into administration. I was an assistant medical director at one of the large university hospitals here in Atlanta, Georgia. And I was so excited about that position. I was so excited to make impact, but I worked during COVID. And it was really such a defining moment for me to see health and suffering, to see disparities at play, to see people who look like me end up in the hospital being affected by COVID, seeing how the healthcare system was, really struggling during this time. There were a lot of cuts, a lot of pay cuts, a lot of changes in patient care. And I really walked away from that experience thinking, man, we need to do more for our patients, right? I don't know if this is it, people pounding and crowding our emergency departments and getting really not the greatest care. There has to be a better way to deliver care. And I knew for a fact that if I continued in the system 10, 15 years down the line, working the same amount of shifts, doing the same thing every day, that I would burn out. And I was on the brink of burning out, really, working in the ER, working during COVID, having my own kid, going through my own personal challenges, and trying to pour into the lives of people in need. I knew something had to change. And so I pivoted. I really started to research and think, what do I love about medicine? And for me, it was the relationships that I form. Oftentimes I sit in the emergency department. I had the residents, so I had this luxury. While the residents are, seeing the patients, I would go and just have chats with my patients, have conversations, talk to them about their health, counsel them. And those relationships were the most valuable. They gave me such strength in a really difficult day. So I thought, how can I continue these relationships? And how can I practice medicine in the most dignified way? How can I bring compassion back to medicine? How can I bring, dignity back to the patients themselves? So I had a mentor who also was an emergency medicine doctor, and he had a concierge practice. And I basically heard about him, and I decided to shadow him. And I would go with him. He would go into people's homes, and he was the family doctor. The sons, everybody knew him. He would go and take care of their mother. He would go there even, 2, 3 times, depending on what they needed him for. And he was managed to do so much in the home, and it put the patient at ease. One of the patients I remember he was taking care of was 100 years old, 100 years old. And she hardly ever went into the hospital. He did everything in the home. And the family was so grateful for the care they received, so grateful that she didn't have to go into the hospital during a really terrible time. And I knew that's what I was going to do. And so I embarked on that journey, and that's what I've been doing.
I love that you pointed that out, because so many times I think the public thinks the only option is the hospital. And
Mhm.
you, us, all the guests that come on, we've been really trying to let people know, everyone who's on their team, both in and outside of the clinical setting, and with a lot of emphasis on who's in the community and what's available. Um, and so I love that you pointed out this desire to want to develop relationships with your patients, right? So, I think especially people pursuing medicine for the first time and in nursing, a lot of attention, and for good understanding, goes to the ED and the ICU, right? That's where all
Mhm.
the action, that's where all
That's the action.
the action is, right?
Woo.
And the focus is on all these skills they're going to develop, as if you're not going to get skills anywhere else. There are
Mhm.
different types of skills. And I think one thing that maybe you don't get in emergency medicine are those relationships, right? Because your goal is to
Mhm.
get you stable and move you on. So you don't have that. And so I really love that you pointed out, like, for students or clinicians who are looking to change specialties, kind of what the difference is there with that relationship
Mhm.
with the patient, even for the patient to realize this, what you're getting in the emergency department is not your whole, it's temporary. It's the
Yeah.
babysitter, right? They assume you're being managed at somewhere else by your primary care team,
Mhm.
by your parents. We're just watching you for a very small time. And so the emergency department is not the primary source of where you should be getting all your health care, because we really want to emphasize that preventative care, that
Mhm.
primary care, so we can decrease costs, decrease all those admissions back to the hospital, the stress, everything that's involved with all of that. And so I love that you pointed that out. And it's interesting to see that after all your time there, that you started to lean towards wanting more of that.
Isn't that crazy? It is actually really crazy, because even one of my other mentors was a family medicine physician in medical school, and she was amazing. I loved her. I loved working in her clinic, and but I would get frustrated because she would deal day in and day out of insurance denials, and having patients come back and not doing their medications. And so I was like, I love what you do, but I have hesitancy because of this thing. So emergency medicine seemed like the way out and seemed like the best way to deliver care. But being in there, I'm like, I'm such a relational person. And oftentimes I'd be in the emergency department. People are like, do you have a card? Like, can I follow you? And have to be like, No, I'm just here and you may not see me ever again, actually. This may be the only interaction. But I think it's just with time you grow and we adapt, we change as humans. And I think it's okay to understand, hey, I thought this was what I wanted to do, but this has changed. I actually value these relationships and I feel like there's an impact and that I am here to have on this world. And I don't know if I can do that just solely working here. I need an extra layer. I need more for my patients. So
And it sounds like for yourself.
for myself, yes, absolutely. Absolutely.
And I think that's important for people to hear that you can make a decision today and change your mind or transition later, and it's
Mhm.
totally okay.
Yes,
Hey,
yes.
your mind. Let's talk about you changing your mind and getting that inspiration. You worked with your mentor, you got to see a different setting. Your
Mhm.
heart is beating a little bit faster, and you're like, I think
Yes.
I might want to do this. Let's talk about your entrepreneurial journey towards starting your own practice.
Yeah, most people when they think that you are going to start your own business, they think, "Oh, it's, all flowers, it's all great." When I actually sent my resignation letter, I had the such peace in my heart, knowing that I was walking away and following my dreams and listening to a higher power, right? I felt called to do this work. And, the next day I showed up at work and, I was so happy. And once I quit, the first 4 months, I was thinking, I have this amazing thing. People are going to come to me. It's going to be amazing. You know, and then reality set in, right? I am now an entrepreneur. I don't have a hospital system that's bringing patients to me. I have to go and find patients myself. So I have to put myself out there. I have to, let people know I exist because if people don't know I exist, then I can't help people. And so I had to channel that part of me. I've read so many books. I've listened to so many YouTube channels. I am literally in business school, right? I am going through it. I joined a recent program for doctors. It's called Entre MD, and it molds doctors to engage in entrepreneurship journey. And so I did all of that. And I remember after 4 months of toiling, finally got, to a good place where I started seeing patients. And, one Sunday afternoon, I get a call from a distressed mother who was postpartum. And she calls me and she basically is telling me, yeah, this thing is happening with me. I went to my doctors and they told me I was dehydrated and told me I was just fatigued, but I don't know, something just doesn't feel right. And I called a friend and my friend told me to call you. And I don't know, maybe you can help me. So I'm watching her on the screen on telemedicine. It's like Saturday. And I'm watching her body language and, I'm connecting. And I'm like, this doesn't sit right with me. So I said, where do you live? I'm coming over. I went to her house. We're chatting, we're talking, and I check her blood pressure through the roof, elevated. 180s over 100. She's within a couple weeks of giving birth, and so I'm like, let's keep talking. Let's do all these other things. Check your urine. Let's basically examine you. Talk to me about your birth. We recheck the blood pressure again, elevated. So at that point, I knew my highest concern was something called postpartum preeclampsia, which is a blood pressure condition, so a hypertension, so high blood pressure, elevated blood pressure condition after a woman gives birth. It happens during pregnancy. That's where most people know about it. They're here, oh, preeclampsia. But actually, you can get preeclampsia up to 6 weeks after you give birth, with a lot of women don't know. So this was my top concern. So we spent that afternoon calling her OBGYN, trying to, get the on-call provider. It was a weekend, it was a holiday, a lot of communication breakdown in that weekend. Eventually, we decided to send her into the hospital. And she went into the hospital and she got diagnosed with postpartum preeclampsia, got put on medications, and then was sent home. But her blood pressures were elevated throughout that weekend. And, in my heart of hearts, I felt like she needed to go back in the hospital. So I stayed with her throughout that weekend. We had made adjustments to her medicine. We got her through Monday or Tuesday for her to go see her doctor. And by the time she got to see her doctors, her pressures were a little bit better, her labs were better. So her doctor was grateful because she was like, I felt like you probably should have gotten admitted to the hospital, but it didn't happen. And thank God you made it to Monday because a lot of women can't say the same.
Mhm.
And at that moment, it took me back to my own journey postpartum as a mom. And it was like God was aligning the stars. It was like, I think this is where I'm needed the most. This is what I need to be doing. Right. And so that particular client of mine, she referred me out to women in her group. And I started getting a lot of calls from postpartum moms and just kind of have been going through this journey, making personalized care for postpartum moms, listening to what they need, getting the resources together. I've gotten birth workers in the community to be on board, just creating these networks to protect our moms. We know maternal mortality rates are through the roof in this country, with Black women being 3 times more likely to die, of pregnancy related causes, right? And we know that a lot of these complications happen after a woman gives birth. People think it happens like, during pregnancy. A lot of women are dying after they give birth. And so this is such impact. And I'm grateful I landed here. I think it was purposeful, it was intentional, and this is where I'm supposed to be.
Yeah, and it's really beautiful because in the beginning, you told us early on when you started thinking about even going into medicine, you thought you were going to go a different, you were going to enter through the OB-GYN route. And
I
isn't
know.
it's just so beautiful how life works out sometimes. It's a different path, it's a different time frame, but,
Mhm.
but look how it worked. It worked out.
Yes, it worked out. It's always working. It's always working. And I feel like I'm a person of faith, and sometimes when we're going through dark times and we don't know, we just get discouraged. And I think it's really it's been lovely to look back at my journey, to look back at where I came from, and to see that God has had a hand in my life. And it's just really inspiring, and it keeps me going every day. And especially when you're in entrepreneurship, you need that because there's so many ups and downs and bumps. And you sometimes question, am I going in the right direction? Do I need to move straight or do I need to pivot? So watching myself go through this journey, I just go back and I look at where I've come from, and it encourages me to keep going.
And so how did you come up with the name for your practice?
Oh man. So I figured I wanted to be able to help people when they're in need. And, people oftentimes don't I felt like they needed a name to kind of sound, hey, like I need this person. So I came up with EM, which stands for emergency medicine. In retrospect, I don't think most people would really take away EM standing for emergency medicine, but I wanted it to be emergency medicine care to you, right? So the to you part signifying that I'm coming to you, I'm meeting you where you are, right? I am going to come to your house if that's where you need me. I'll get on the phone if that's where you need me. I'll go to the office if that's where you need me. And I'm providing that emergency care to you. And so I wanted people to understand that, like, when there's no one else and you're in dire need, that I'm available for you. And so that was the EM care to you. And the care part was really just providing, because that's what I'm doing. I'm caring for you, that holistic, that compassion that comes with it. And so that was the name that I chose.
And so you offer concierge medicine, and can just describe what that is for the people who are watching and listening.
Yeah. So concierge medicine is basically direct access to your provider, right? It means that there is no middleman. So the relationship is between the patient and the provider. Right. So when people come to me, there's a lot more transparency, right? The conversation is with me. There's no insurance companies, there's no bureaucracy in the middle, all these weird, policies that come with being in a facility, with being part of a huge network. I don't have to break that down as much for my patients, right? It's like, let's address your problem, and there's more of a personal relationship. It's a personalized care model, meaning that I treat you as an individual. I don't treat you like how I treat the 100 or 200s of patients, because you're different. And when you take that and you look at it and you apply it to certain aspects, for example, postpartum care, right? There are symptoms that women develop that will signify, oh, this person has postpartum preeclampsia. But the reality is, some patients won't get the headache. Some patients won't get the blurry vision. Some patients won't get the swelling. And so I can apply that model and say, let me look, you don't have those things, so therefore you don't qualify. I'm having a personal relationship. I'm talking to her. She didn't have those symptoms, right? But her blood pressure is through the roof. And that's a diagnosis she had. But if I had not taken the time to speak with her, to evaluate her as an individual, I could have missed that diagnosis. And that applies to all aspects of life. Standardization is great because that's how we prevent negative outcomes. However, people are individuals. They present differently. And so it is super important to have personalized care with your provider because you're not textbook all the time. So that's concierge medicine. It really gets back to, that relationship. And oftentimes people think boutique medicine, this is for the rich. It's not just for the rich, right? There are care models that are super affordable that you can have depending on where you are in the country. You can tag it along with your insurance. Many of us have high deductible plans, and going to the ER is going to be $6,000, right? And you're not even going to get the best care, in the emergency department. So why not add on this additional layer of care to how you receive care? So
Yeah, I think those are some of the two of the biggest differences between people are used to and concierge medicine are
mhm,
access, which you just described, right? You get a
mhm,
certain level of access to your provider, whether that's unlimited visits a month or you
mhm.
haven't you know upfront how many visits you can get. You
Exactly.
don't have to wait 3 or 6 months to get an appointment that lasts
Mhm.
10 minutes.
Yep.
Hi, I'm Alicia from the Melanin Initiative Podcast. Our mission is twofold. One, to simplify complex health information so you feel empowered to ask questions, educated on how to manage your health, and confident to navigate the healthcare system. And two, to elevate the expertise of nurses, spotlight the diverse career opportunities within the healthcare industry, and inform our peers how to leverage their expertise as clinicians and entrepreneurs. In less than 2 years, we've grown to over 50,000 views and 1,000 downloads, with an international audience spanning the US, Canada, the UK, Australia, and more. Our engaged listeners are professionals, entrepreneurs aged 25 to 44 who value authentic, impactful content. Want to connect with this dynamic audience? Advertise with us. Send in your 1 minute video ad and let's amplify your brand. Email tmi.melanin@gmail.com for rates and details. Let's work together.
And then, yeah, the cost of the care, right? And so people don't tend to realize that even though they have their employer insurance, by the end of
Mhm.
the year, if you really look at all your out of pocket costs and the care that you receive from those out of pocket costs, maybe you had a relationship with your provider, maybe you didn't. You
Exactly.
used all that money and got the care you wanted, the relationship you wanted, and it's transparent. You know exactly where the money's going. There's no surprise billing. There's no extra envelope coming in the mail. It's
Mhm.
all very transparent. And it's kind of just like you're on call, right? You're my
Yes.
on-call provider. We know each other
Yes.
by first name.
Mhm.
And it just brings so much comfort to people, and it's growing in popularity. And this whole personalized care service, that's what patients complain about the most.
Yes.
That's the main thing they complain.
All day, all day. The doctor didn't touch me. The doctor didn't talk to me. I'll talk to family members and they're like, he doesn't even talk to me. He just, diagnosed, sent me a pill, and you're thinking, man, is that true? But I don't know. That's the patient's experience. And so this is different. It's much more comfortable. You're in the home of the patient. And if your concierge doctor doesn't do in-home visits, you're in a comfortable office space. You have that relationship. You can call them, you're traveling, you have that access, and someone who can take the time to break things down, right? It's not like, hey, I have a schedule full of 20 people, so make an appointment to talk about that later. It is an opportunity to break things down. So those relationships are so much more sweeter. It's just a better experience for everybody.
So true. And so, what services do you offer?
Yeah, so I do primary care, as we just discussed. I do urgent care visits. So I go in the home. If somebody has a procedure like lacerations, like if they cut themselves and I need to sew them up, I can do those things. Very small abscesses, I can drain those in terms of procedures. For postpartum things, this is, I love doing this because I go in, I examine patients, I'm seeing how they look. I really love to do an evaluation after they give birth. I'm checking for swelling. I'm really asking them about their amount amount of bleeding they have, because by the time they're going, to 6 weeks, they could have bled out. One of my clients ended up being readmitted to the hospital within probably 2 days of being home, because she had life-threatening bleeding and had to go back to the operating room. So just having that eye to be like, oh, this is not normal. The bleeding, the headaches. Sometimes as women, we can say, I'm just stressed, I haven't slept, right? It's like, no, tell me about that headache though, because that's not normal. Let's break that down. Breastfeeding challenges. So a lot of women are having a lot of discomfort. By me seeing them, I can say, hey, we can intervene. Let me get this lactation person to come here, evaluate you. Back pain. Oh my goodness, the amount of postpartum moms that suffer with back pain. So a lot of dealing with that, the neuropathy, the nerve pain that comes after delivering a child, right? Carpal tunnel. A lot of moms get a lot of hand disorders from carrying their baby, from the swelling. And so we deal with a lot of these urgent care procedures. And then also just making sure our mom's nutrition is optimized, right? Most of us are low in vitamin D. I make sure they're, supplementing, they're eating appropriately. I have a nutritionist on staff who helps create diet plans, who helps if someone was diagnosed with preeclampsia and they're on blood pressure medicines and they want to come off of those medicines, they can come off of those medications. Besides postpartum care, I also provide, something I call executive care. That's for busy professionals who are traveling around the country and also just need that convenience. So really, I provide a lot of care. Oh, pediatrics. I don't do primary care pediatrics, but I do urgent care pediatrics. So this is a hot one because a lot of moms wake up and on a weekend and their kid is sick and everything is closed. They don't want to go to the ER. Ear infections, strep throat, I can diagnose all of that within the home. So it's a wide range of conditions that I treat.
I love that. And then what is your cost coverage like?
Sure. So for per month, I charge $199 for an individual. And what that includes, this is for membership. So $199 for membership per month. It includes unlimited telemedicine. So they can call me, someone can call me as much as they want. They can text me. I have a medical record system where their text messages actually go into their chart. They can email me. That also goes into their chart. If they're traveling and they need something, they can access me. If they require a home visit, a member gets 50% off of what I charge non-members. So non-members, if they just need somebody to come to their house, I charge $299 for that visit. They can use their HSA card, which is their health savings account. So they can use that card. I also provide them with the receipt. They can get that reimbursed with their insurance to go towards the deductible payment. But for members, they get 50% off of that. So their visits are actually about $149 if they need me in the home. But for a lot of member patients, we could settle a lot of things on telemedicine, to be honest with you. And sometimes it's just conversations like, hey, I went here and the doctor at at my whatever specialist office recommended this, but can you talk me through that a little bit? And we talk about it. So it's really a doctor in your pocket, if you must say. So that's for individuals. Families, family of four is $499. That includes kids, adults, and they could utilize me as well. And so it just depends on your family structure, if it's just you or your entire family. Most of my patients right now are families because they have small kids and they just don't want to deal with being in the ER with 2 or 3 children.
No, I hear that. Yeah, that's actually a really great price for a family, especially if you're
Mhm.
talking about avoiding getting in the car. Maybe you have to leave one baby behind. Now you have to find a
Yep.
babysitter, and it's like,
Yep.
it just adds up. It's
It
not just
adds up.
a trip to the ED anymore. And you don't know how
It
long
adds
you're gonna
up.
be there either.
Exactly. It's your time. It's that time that you could be more productive, you could be working, you could be doing other things. And really I tell people your time is more important than anything. And I always lead with that. I'm like, ask yourself how much time it's going to take to get from point A to B. How can I shorten that? Calling me versus finding a babysitter, driving to the hospital, waiting 4 or 5 hours to then be seen, given an antibiotic, go home, right? Get yourself together. It could be 5 or 6 hours you're wasting versus if you just call me.
And when you're sitting in that ED, it's there's everyone there is sick, friends.
Mhm.
You're walking out with more than you came in with.
Absolutely. You are going to you're going to walk away with a lot of things, especially when you have young children. Oh my gosh, you're going to get treated for one thing and then you now come out with COVID or flu. Like you don't want to do that.
Yep.
Absolutely not.
And now we know people are caring for their older parents too. So it's not just a babysitter for the young kids. Now who's going to watch after mom and dad? So it's a huge, so many advantages.
Yes. Yeah, and I would say with just I think they call it the silver tsunami, right? Our boomers are aging, and so the hospital systems in about 10 or 15 years, they're going to be over flooded, and we're going to have to get creative with how we're providing care. So, I mean, right now it may seem like a foreign thing to do home visits for a lot of people because they're not exposed to that, but in about a couple years, this is the way of medicine because our hospital systems are going to be bombarded because our boomers are aging. And a lot of them actually who are aging out, they are seeking this type of care because they understand and they know that this is the best care for them. So a lot of that age group is even looking into different models of healthcare. So this is the wave of the future for sure.
In particular, when it comes to those new moms that you're treating, what's been
Mhm.
your experience on how personalized care impacts their outcomes?
Oh my gosh, I have so many stories. I would just say the biggest thing in my practice that I do is advocacy, right? So I am not an OBGYN, and I have to tell people that I am not an OBGYN. I cannot take you back to the operating room. I cannot deliver a baby. I mean, I know how to deliver babies because we deliver them in the emergency department, surprising, and I've done it in medical school, but that's not what I do, right? And so the biggest thing is bridging that gap between the patient and the OBGYN. So these are my colleagues. I have more access to the OBGYN, more access to the midwife because I have those relationships. And so oftentimes I've had to get on the phone with an OBGYN, with a midwife, with an ER to say, this is what's going on. This is what I'm concerned about. I need you to hear her out. I have one mom who was kind of tossed around the healthcare system a bit, and because nobody was listening to her. And I remember having to call, specialist to specialist. One of her doctors gave her a referral and said, this is a stat referral, call the clinic and tell them that I gave you a stat referral, you need to be seen immediately. She calls, her stat referral is 3 to 4 months. And so she's calling me and she's given up. She's like, well, this is a stat referral. I'm like, no, that's not how we do this. They need to call that person and say, I need this person seen in 2 days. Right. And so they were busy. So what did I do? I called the specialist. They need to be seen in 2 days, ASAP. Right. But this is not, they need to get seen. They get seen. They get, blood work. They said, okay, if this blood work comes back as normal, we're going to need to admit you to the hospital and, all of these things. I'm like, this has to get done. Long story short, eventually they had to get the patient in the hospital to get their workup done. When they were there, they had a life-threatening emergency. Everything was now in a rush. They had to do a lot because it was determined after getting the imaging and the blood work that her condition was actually emergent. But if she had stayed on the outside and nobody had, advocated for her to get in and get seen, get the imaging that she needed, she may not be here. And so that's the part of my job that I really feel like is super important, that advocacy part, especially for postpartum, because we know in a minute complications can happen and take our lives. And so being able to advocate for my patients to say, no, 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 they need to be seen. No, 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 this is needed. Huge, huge.
Yeah, we couldn't agree with you more. We've done an episode dedicated to advocacy when we first started the show. And then we have a couple of series that we do called Becoming. One of them is
Mm.
Becoming a Physician with the guest star Clarence Sams, who's currently a second-year medical student at Charles Drew University in California. And even as a medical student, he realized already that his biggest job is advocating.
Absolutely. Absolutely. It's huge.
Yeah.
It's huge, especially in our communities of color. We are advocates. I mean, it is a constant. And the thing is, I may see things differently than this person may see things. Like I can walk into a room and I have an instant like, I can have that instant connection and I know something's wrong. And it's not to say that my colleagues who don't look like me don't understand, but there's cultural nuances there that I have a little bit of a better understanding, right? I remember walking into one of my shifts in the ER and I immediately saw a mom and she was postpartum. She just started bawling, just crying. And, because she's like, I don't know how to explain it, but something is wrong. Something is wrong. Now, someone who may not have the patience to be like, well, what is wrong? Like, tell me, like, what is wrong? But at that minute, I knew number one, she feared she was going to die and not be there. And that fear was very real for a Black woman.
Mhm.
Right. And so I understood that. I understood that experience. And I sat and listened, and we were able to tease out her symptoms to figure out what was exactly going on. And she was right because she listened to her body. Something was wrong. But I feel like that patience, that just like that connection I had, I was able to sift through and get to what the crux of the problem was. And so that piece is so crucial for our communities.
And so, what advice do you have for patients and their families on how they can better advocate for themselves?
Yeah, so I want to tell people speak up. I think oftentimes we get scared. I deal with it with my parents. My mom she's a nurse, right? She is a whole nurse. Yeah, she is. I have a family full of nurses, my brother and my mom. But even my mom, if she ends up in the hospital, she's not advocating for herself, right? She's quiet, and I have to get on the phone and speak up. But when I talk with her, it's almost this fear of what they're going to think of me, that maybe I don't know, or maybe that I'm less than. It's this fear that overcomes them, and they just don't know what to say. And so I really encourage my patients to use your voice and honestly just practice. I think sometimes we when you get in there, it's like you just get scared, but practice at home what that looks like, and plan your visits ahead of time. So write everything down, write all your questions down. When you go to your doctor's office, take a notebook, write the answers down. Ask all these questions. If you need an advocate, there's a lot of hospitals that provide advocates who can go with you to your appointments. Take someone to your appointment. If you have a daughter who is in the healthcare field, if you have a friend, if you have a sorority sister who works in the hospital, who's a physician, get them on the phone. Because if you know that there is some barriers when it comes to communicating with your provider, then you need to take somebody with you to your appointment, write the things down, and really try to get to a point where you feel empowered to make decisions for your health. Because this is your health. You have to say, yes, this is what I'm going to do based on the information that you've given me. So advocate for yourself. If you can't, take somebody with you, right? If you don't have anybody with you, you can ask at a hospital for an advocate, or just plan your visits ahead, practice at home the questions you're going to ask. And then lastly, know your medical condition. If you have been diagnosed with diabetes, make sure you understand what that is, right? Make sure you understand how to deal with the diabetes. Make sure you understand your medications. And if you don't know, that's okay, because a lot of people don't understand that. So let's write the questions down and gain some understanding from our medical provider. And if you don't have that, ask your doctor, who may not have the time, to give a resource of somebody who does. There are nutritionists out there, there's diabetic specialists. They are resources that insurance does cover. And if you don't use your insurance, if you don't have insurance, there's stuff you can pay for out of pocket. So there's also online resources that you can research. So be your own advocate.
And you've done a wonderful job putting together some helpful tips for patients called Speak Up, How to Navigate Healthcare with Confidence. Can you share some key takeaways from that guide to empower our listeners?
Yeah, number one is just knowing your rights. I think I put together what rights you have as a patient. This is not the olden days where people can just do things to you without your knowledge. So you have rights. And if your rights are being violated, you should know that. So I start off the guide just explaining to patients, like, here are your patient rights. So you are aware, like, you have rights as an individual. And then after that, it's really about gathering information about your health. So it's how you can empower yourself. So writing your medical conditions down on a piece of paper, writing your medications, your allergies, having all of it in one book. I provide, some checklists to help you plan for your visits when you go to the doctor. And then when you're there, you're going to talk about your questions. You're going to ask for clarification. You're going to try to, speak up and get clarity if you need to. And then at the end of the guide, I talk to people about what types of doctors they see when they have a problem. So sometimes people go straight to the ER when they have certain conditions, but they can call their primary care physician. So this is who you call if you have this type of a problem. This is where you go when you have this type of a problem. And then I just end the guide with just some resources that they can use to just learn about their medical conditions and just about healthcare in general.
And you didn't stop there. You wrote a book called What to Expect Next, which focuses on postpartum care. What are some of the most important considerations for mothers during the postpartum period that you've included in there?
Yeah, so a lot of body scanning. I start off the book with telling my own story and my challenges, and then I go into everything that can happen within the first 6 weeks because I don't think a lot of people understand. I think most people are like, oh gosh, I made it through pregnancy, I made it through childbirth. I don't think they really truly understand the challenges that exist after somebody gives birth. There's so many books out there that talk about pregnancy, giving birth. There's not a lot that really break down postpartum. And so one is I wanted to educate moms on what can happen in the postpartum period, right? It's a serious time. And then two, I wanted to give them tools to get through. So each week they're going through before they actually deliver, they're gathering who is my care partner. So, who's going to do this when I'm postpartum? Who's going to cook? Who's going to be my person when I'm in need? Do I have a therapist if I need one? So just writing down these resources before delivering. And then once they deliver, each week, you basically are going through and asking yourself, do I have a headache? What's my blood pressure today? I'm a believer every woman who delivers a baby needs a blood pressure cuff, hands down, period. Every single person. It's not just about, oh, I have a headache, blurred vision. Now let me go to the store and get a blood pressure cuff. Nope, you're checking your blood pressure postpartum. That's my policy. And I will scream that to the mountains. That's how I feel about it. But yeah, they'll check their blood pressure within that first week. They'll ask themselves, how's my bleeding? And then it says in the first week, your bleeding should be, as X, Y, and Z. You should start to notice these things. Let's check in with your body. Are you experiencing these symptoms? And then also I have these wonderful prompts at, meditation. I have women journal. And then if they write things down, I, say, hey, talk through these things with your mental health professional, or talk through these things. If you have these symptoms, they're concerning, call your medical doctor. And so it's a guide. It's really interactive. They get to write down who's cooking which week, who their person who's helping with laundry, clothes, all of this stuff. And it's just super necessary because if you don't have a plan, it's going to be one of the most chaotic times of your life, honestly. And so the support is necessary. And if you already know you may not have that support postpartum, it's good to start planning early about how it's going to look those first 6 weeks after you give birth.
I think you've done a great job pointing out how often in society we prepare for that big occasion, right? The
Mm-hmm.
giving birth, the wedding, and the surgery. But
Mm.
not enough for the postpartum,
Yes.
the marriage, or the
Mhm.
post-op.
Yes.
Really, those periods are
The
long.
parenting,
Yes,
right?
so much longer than those hours that you planned for the last year.
Yes. Yes, it's terrible. But, someone I used to have a friend of mine, and he basically would get a coach for every aspect of his life. He would get a professional coach to get him to the next career. He would get a fitness coach to get him to lose that weight, to get to wherever he needs to go. And he said, if I'm going to be a parent or a dad, I'm going to get a coach because I didn't have good examples for that. And it just brought me back. I'm like, oh my goodness, like, it's such a true story. We get coaches for all these other things in our lives, but important things, we don't have the tools to get through it. We don't have the tools to get through our marriages. We don't have the coaches to get through. We don't get the coaches to get through our marriages, right? Even our parenting. Some of us are just winging it. Our parents winged it. We're winging it too, right? And so is the same with postpartum. Let's not wing it. Let's plan, right? If we don't know, let's get the resources, because there's enough women now who will tell you after going through it that it was hard. Okay. It was not easy. If someone says postpartum was a breeze, good for them. Okay. But it is not a breeze. A lot of women struggle, if not with their bodies, but just like navigating relationships, just being a parent in itself.
That's a great line. Postpartum, let's not wing it.
Mhm.
And like a true entrepreneur, you didn't stop at your books. You've also created a podcast and a Facebook support group for moms. How can these
Mhm.
resources help women during postpartum, and where can they find them?
Sure. So, Fourth Trimester Voices is a podcast that I have, and we talk all things within the fourth trimester. I use that platform to amplify voices of moms and voices of birth workers, because there's power when we share our stories. Oftentimes, people don't feel like they can share, right? One of my moms on the podcast talked about how she basically had thoughts about, hurting herself or killing herself, but the fear of telling your doctor that, because you don't know if your kids are going to be taken away, right? But being able to talk about that. So if somebody is going through that, they can understand, oh my gosh, I'm not the only one who's going through that. Let me figure out how to get help. And maybe they can see how other people got help, right? Which resources they went to. So sharing our stories, I use that in my podcast platform. I have a Facebook group that's called Beyond the Fourth Trimester Postpartum Support Group. And this is more interactive community of other moms. There's moms who are just recently postpartum to moms who are beyond the fourth trimester. Because if you can talk to somebody who's far down the line, maybe they'll tell you what they could have done, should have done, right? Because now they're, looking back and saying, oh my goodness, right? It is so important. I have an event coming up in Atlanta that is for moms, and it is a mom shower. Okay. It is a mom shower that we have. And the reason I'm bringing that up, it's called Empower Mom. But the last one we had in May, we had moms who were pregnant, and then moms who had delivered. And one of the most powerful things of that shower was I had one pregnant mom, and she started crying because she was scared about, you know, something childbirth, about being induced. And another mom stepped up and said, take your power back. Take your power back. Yes, you are scared about this big decision that the doctor is saying. They're saying you need to be induced. Take your power back. Call the doctor. Say, I'm going to pick the date, right? I'm going to pick the date when I'm induced, right? Because, yeah, you need to be induced, but take your power back and say, this is the date that you're going to induce me, because you have that right, right? And that was the most powerful thing that mom offered. The pregnant mom ended up being one of my patients, but she talks about how those words from that mom were so impactful in how she handled her delivery. And so getting together as women, postpartum, however far down the line, super important to have that community. So I try to build that in different avenues, whether it's a podcast, a shower in the community, a Facebook support group. I'm going to find moms. We're going to get together and get through this together.
I love that. As we get prepared to close out, if you could offer one piece of advice to our listeners about taking control of their healthcare journey, what would it be?
You are in control of your health, right? Oftentimes we feel like they gave me this diagnosis. They gave me this thing. I'm now diabetic. Now I have high blood pressure. Whatever the case, I have to just take these medicines and that's it for me. That's not true. You can get off of your blood pressure meds. You can get off of your diabetic meds, obviously, unless you're type 1 and certain conditions. Have a conversation with your provider before you do this. But the point I'm trying to make is, just because you've been told that you now have this chronic medical condition doesn't mean that now it's hands up. It is what it is. I'm taking these meds. You can change your diet. You can find the resources. You can find the doctors who will partner with you to look at how you eat, right? They're not going to tell you to stop eating your greens or, whatever else. They're going to tell you, prepare the greens in this way, right? Find the people who are going to support your healthcare journey. You have to take control. It is not a death sentence when you get a diagnosis. You can find how you navigate that diagnosis, right? With confidence. You have control. So don't feel discouraged by that diagnosis that you received. don't feel discouraged by where you are in your healthcare journey. Get yourself the strength that you need and find avenues and ways to feel empowered, to make the changes that you need to navigate that condition, that chronic medical illness with confidence.
Oh, that's so beautiful. I love what you said. You reiterated so many points we've made on this show. And so I love that people are able to keep hearing it over and over and over again. And hopefully that message is being driven home. How can people connect with you so they can learn about your books, your podcasts, your services that you're offering, and the events that you're putting on in the community?
Sure. So you can reach my business is www.emcare2u.com. So if you're in the greater Atlanta area, that's how you can connect with me. Otherwise, I'm on Facebook at Dr. Chowa, CHOWA, at emcare2u, emcare2u. And on Facebook, you can find me. I have a page. There's a fourth trimester voices page. There's the postpartum support group I talked about, Beyond the Fourth Trimester, a postpartum support group. And then I have my podcast. You can find me at all, Apple, Spotify. It's called Fourth Trimester Voices. And hopefully one of these days I'm going to have, www.drchowa.com where everything will be easy to find. But for now, you can find me just doing a Google search.
Okay, wonderful. Well, we can't thank you enough for coming on to share your time with us. You did a great service for our audience in teaching them about concierge medicine and all the benefits and advantages to transitioning how they spend their time and where they put their dollars. We loved being able to hear about your medical journey and how you navigated, pivoting and changing your mind and actually ending up right where you wanted to start from the beginning. We love being able to promote entrepreneurs, really understand the value of owning your own business, your own assets, and building something for your family. That's something we like to emphasize here, and to show clinicians how they can really optimize on their clinical training and education beyond the clinical setting or beyond that direct patient care relationship into something bigger that not only benefits them, but benefits the community at large.
Absolutely.
We'll put all your links and contact information in the description box. If you ever add on a new service or you want to promote something, the invitation is always open and you can always return and come back.
Thank you so much. This was so lovely speaking with you today.
Oh, and shout out to the gentleman who you kind of found us through. What was that guy's name again?
Oh my gosh, I'm going to mess up his name, but I think his last name was Kearney. Kearney, shout out to him.
Well, thank you. Remember, everyone, you can email us your questions and show ideas to tmi.melanin@gmail.com. If you haven't already, subscribe to our YouTube channel, LinkedIn, and all of our social media platforms. Say hello in the comments when you get there. Share this show with your friends and rate us on the Apple and Spotify podcast. Remember to leave a comment. It really helps you support the show. And like I said, when people like you look for information like this, it makes sure that we show up higher in the search results. You can find all of our links in the description box, and all the resources that we mentioned will be there as well. We do have some playlists that will link throughout the show too, so you can see other topics that are similar to this that we've discussed in the past, particularly our maternal health playlist. We release new shows weekly on Sundays at noon Eastern on YouTube, LinkedIn, Instagram. Eventually we'll be on Facebook once we get enough followers over there. And we always drop the podcast at 5 a.m. for our night shifters, so they can be the first to get something and not the last. And then so our day shifters have something to listen to before they get their day started. We thank you again, Dr. Chowa. You're always welcome back. And we thank you everyone for watching. We'll see you next time.
All right. Thank you. Bye.